The upper esophagus is skeletal muscle, whereas the lower is smooth, and in the middle it's mixed. That same concept is taken to the mediastinums. The upper esophagus is located in the superior mediastinum, whereas the lower is located in the inferior posterior mediastinum, or posterior inferior mediastinum, depending on how you want to say it. And the middle is both of those, the superior and the inferior posterior mediastinum. So the mixture of mediastinums of the middle esophagus, specifically the mixture of the middle of the upper and lower, is analogous to the different types of muscles of each portion of the esophagus, with the middle being mixed, the upper being skeletal, and the lower being smooth. Lastly, we have different blood supplies for the different portions of the esophagus. The upper portion of the esophagus gets its blood supply by the inferior thyroid artery, which is a branch off the thyroesophageal trunk, which is a branch off the subclavian artery. That inferior thyroid artery also perfuses the thyroid gland with the superior thyroid artery, which is a branch off the external carotid artery, specifically the first branch off the external carotid artery after it bifurcates from the common carotid artery. So that common carotid artery bifurcates into the external and internal carotid arteries, and the first branch of the external carotid artery is the superior thyroid artery, which perfuses the thyroid gland with the inferior thyroid artery, and the inferior thyroid artery also perfuses the upper portion of the esophagus. The middle portion of the esophagus is perfused by the esophageal arteries, and these esophageal arteries come off the descending thoracic aorta, or they come off the bronchial arteries. In the bronchial arteries, we have two on the left and one on the right. The two bronchial arteries on the left side of our body come off the descending thoracic aorta, whereas the one bronchial artery on the right side of our body either comes off the descending thoracic aorta, one of the two left bronchial arteries, or the third posterior intercostal artery. So the one right bronchial artery has three different points of origin, whereas the two bronchial arteries on the left both come off the descending thoracic aorta, and these help give rise to the esophageal arteries if they don't come off the descending thoracic aorta directly. Lastly, the perfusion to the lower esophagus is by the left gastric and left inferior phrenic arteries. The left gastric artery also helps supply the left side of the lesser curvature of the stomach, and the left inferior phrenic artery is the first branch off the descending abdominal aorta. Not thoracic, but off the descending abdominal aorta after the descending thoracic aorta pierces the diaphragm at vertebral level T12.